It was March 12th that you announced the first case of COVID-19 in Saskatchewan. It's June 12th. We are 3 months in. How has your life personally changed since March 12th?
Well, I think, and of course, the COVID saga started for us early in January and picked up pace in February. So for us, really, February actually was starting to become a very busy month because we were doing all kinds of prep for a potential first case. And, actually a day feels like a week and a week feels like a month. And, now, it's hard to imagine it was only 3 months ago because work life has changed, home life has changed. Actually, I've been spending more time actually with my family in a very structured way than I would have been previously. Previously, I was driving kids around, other stuff, but now there's more time to actually spend with family. So it's been really interesting in that sense as well.
Walk me through your day. What do you do from when you get up till when you go to bed? What does your day look like?
So February, March was extremely busy. It usually start at 4 a.m. and kind of doing in the morning, doing a lot of the prep for the meetings in the day. And so there would be frequent FPT meetings with my counterparts in other provinces, daily meetings with medical health officers in the province. So the national collaboration and the provincial collaboration was a daily occurrence. So the mornings were more prep for the day, and then evenings were spent till about midnight, reading up on media, reading up on international reports, and then increasingly in March, actually, evenings would be spent late into the night reading up on the latest research, because that's really important. And the research came fast and in great detail, and so that's been really important to inform our policy as well.
When you go home at night, I know as a journalist sometimes we have a hard time turning off the news. It's hard to stop checking your email, following up on the things that are the latest. In your case, are you able to turn it off? Are you able to stop? Are you able to take vacation?
So in February, I was not able to turn my mind off even when I was sleeping. I was dreaming COVID. I was having pandemic nightmares, and 20-hour work days, at least 2 or 3 hours reading up on the latest international reports and media reports. I think I have seen maybe in May I saw 1 movie or 2 movies on Netflix. 2 movies maybe I saw on Netflix, and that's about it. And a lot of my entertainment has been reading up on the literature. In my downtime is reading up on literature on COVID. But of course, taking that half an hour, 1 hour of dedicated family time, nothing to do with COVID, has been essential. Having that walk with my wife, or a bike ride with my son, where it's not about COVID. And that half an hour or 1 hour is regenerating. And then I took 2 days off, which was again looked like 2 weeks. Actually, it was a 2-week holiday. I know that first Saturday, the first 4 hours, I did mundane chores like buying stuff for the lawn, and it felt exhilarating just doing mundane things on a Saturday morning.
I feel like I should ask you about what's happening in the States, because they've seen some pretty intense increases over the last week in some cities that felt like maybe they had gotten to a place similar to where we are now, and they're concerned that maybe they're starting to see the beginning of the second wave. That is not something that's going to keep you up.
Yeah. So in terms of the Saskatchewan readiness and response, we definitely will see small clusters over the summer. But we have to keep our capacity up to follow up on them. We have to make sure if you are symptomatic or otherwise concerned, you go for testing. That's how we can keep an eye on COVID and respond quickly. The general professional opinion is that we will see successive waves, and hopefully they will be as small as we had in the spring, March, April. But I think they may be a bit larger, because I think we won't go into the same lockdown that we went in March, April. And in the fall, I want to start talking about mask use more, because I've always said that the one thing we have in Saskatchewan is space. And so you can easily maintain physical distancing when you're out and about enjoying the outdoors or shopping. But when you can't, like in personal care services, medical services, mask use is important. I think that's something we need to just learn how to use appropriate either engineering controls, a plexiglass barrier, or other personal protection when required in a meaningful way. And that may mitigate some of the impacts in the fall of a potential second wave. So I think those two things are important. In terms of global outlooks, obviously, interprovincial travel has to start at some point, but then we have to make sure we can share information on case contact investigations quickly. Obviously, at some point, international travel has to start. You can't have the U.S. border closed. But again, if you do things the way we're doing, like if you come from a hotspot, stay at home for 2 weeks, that quarantine, I think we can keep our risk down to significant levels. How we manage some of those challenges as we move forward is going to be key.